Maria von Kerkhoff, our technical lead for COVID-19. We have also Dr. Bente Nicholson, Director of Non-Communicable Diseases. Joining us online will be Dr. Mike Ryan, our Executive Director of the Emergencies Program, and Dr. Sumia Swaminathan, our Chief Scientist, will join us in the room. As usual, we are translating this in the 6 official UN languages with Portuguese. We exceptionally do not have translation into Hindi today. Sorry for that. We will be posting the Director General remark, and an audio file of this press conference will be sent to you on the web as soon as possible. Full transcript will be available later. But now, without further delay, I will hand over to Dr. Tedros to give you his opening remarks. DG, the floor is yours.
Shukran, Fadila. Good morning, good afternoon, and good evening. Yesterday, I had the honor of addressing foreign ministers from G20 countries. The focus of the discussion was on how together we can reopen societies, economies, and borders. This is something WHO supports wholeheartedly. Lockdowns are a blunt instrument that have taken a heavy toll in many countries. With the right mix of target and tailored measures, further national lockdowns can be avoided. Several countries are using a data-driven approach to drive a targeted response. This is allowing them to open up carefully and safely, while remaining ready to respond rapidly to any new clusters or amplifying events. Once again, I want to reiterate the 4 priorities we urge countries to focus on: prevent amplifying events, empower people to protect themselves and others, focus on the public health basics, and protect the vulnerable, including older people and those with underlying conditions. COVID-19 has preyed on people with non-communicable diseases such as cancer, cardiovascular disease, diabetes, and respiratory disease. Globally, NCDs their risk factors are increasing vulnerability to COVID-19 infection and the likelihood of worse outcomes, including in younger people. The odds of developing severe COVID-19 have been found to be as much as 7 times higher in patients with obesity. Smokers have been found to be 1.5 times more likely to have severe complications from COVID-19. And a systematic review has shown that people with diabetes are between 2 to 4 times more likely to have severe symptoms or die from COVID-19. The pandemic has underscored the urgency of addressing non-communicable diseases and their risk factors. Next week is Global Week for Action on Non-Communicable Diseases, which aims to increase accountability by governments, policymakers, industries, academia, and civil society to reduce the NCD burden globally and increase health and equality. Today, I'm pleased to launch a set of publications that have been developed under the UN NCD Interagency Task Force that call for urgent action on NCDs during and beyond the pandemic. First, we call for the voices of people living with NCDs to be heard in all discussions about policies that directly affect them. Second, we call for global financing instruments to be extended to low-income countries that request support for non-communicable diseases. And third, we call for constructive dialogue or partnership with the private sector. Because people with NCDs are at high risk of severe COVID-19, finding effective therapeutics for these patients is a high priority. Earlier this week, WHO issued new guidance on the use of corticosteroids to treat patients with severe COVID-19. Evidence shows that corticosteroids can be life-saving for patients on oxygen and ventilators. However, Corticosteroids do not help patients with mild or moderate disease and can be harmful. WHO therefore recommends the use of corticosteroids only in patients who are severely or critically ill. These guidelines combine the highest scientific standards with the urgency needed to respond to this pandemic. Providing guidance on therapeutics, diagnostics, and vaccines is one important part of WHO's work. Ensuring access to those products is another. In the coming months, we all hope to have good news about a vaccine for COVID-19. But if and when we have an effective vaccine, we must also use it effectively. In time, as production increases, we want all people everywhere to have access to vaccines. But initially, when supply is limited, priority must be given to vaccinating essential workers and those most at risk, including older people and those with underlying conditions. In other words, the first priority must be to vaccinate some people in all countries rather than all people in some countries. This is not just a moral imperative and a public health imperative. It's also an economic imperative. In our interconnected world, if people in low and middle-income countries miss out on vaccines, the virus will continue to kill and the economic recovery globally will be delayed. So, using vaccines as a global public good is in the national interest of each and every country. Vaccine nationalism will prolong the pandemic, not shorten it. The COVAX facility is the agreed international mechanism for ensuring equitable global access to vaccines. It is solidarity in action. COVAX guarantees access to the world's largest portfolio of vaccine candidates. Our partner, the Coalition for Epidemic Innovation and Preparedness, CEPI, is supporting 9 candidate vaccines that will be made available to the facility if successful, 7 of which are in clinical trials. We're also in discussions about 4 other promising vaccines. Another 9 candidates that are in earlier stages of development are being evaluated for inclusion in the facility. We're delighted that 78 high and upper middle income countries and economies have now confirmed they will participate in the COVAX facility, and the number is growing. I urge those who have not yet joined to do so by the 18th of September. I would like to thank those countries and economies who have announced publicly they're joining COVAX this week: Germany, Japan, Norway, and the European Commission. Vielen Dank, arigato gozaimasu, takshka duha. Of course, many more countries have joined, and we look forward to being able to share the full list in due course. Although we still face many challenges, WHO is encouraged by the progress we have made against this new virus in 8 months. With national unity and global solidarity, we can and will end this pandemic. I repeat, with national unity and global solidarity, we can